focus on the UK, where the vaccination drive is going well and most restrictions in England have been dropped. The first passengers have also begun to arrive in the UK after rules changed to allow people fully vaccinated in the US and EU to avoid quarantine. With more than 85 million COVID vaccine doses administered in the UK, the country is now offering an array of incentives to encourage people to get the vaccine. Many younger people who haven't. There are also reports that even booster vaccinations against COVID could reportedly be offered to as many as 32 million Britons from next month alongside flu jabs. To talk more about this, we're joined by Dr. Veer Pushpak Gupta, physician, National Health Service, involved in research as well. Thank you so much, Doctor, for joining us on the show again. So first and foremost, tell us what the situation is like in the UK. The vaccination drive is moving well. Most restrictions have been eased, and now travelers are also being allowed in from the US and EU.
Yes, thank you for having me on the show once again, Gargi. Yes, absolutely. It's been a phenomenal vaccination drive. We've managed to vaccinate about 89% of people with the first dose and 72% of people with the second dose. And I think that's almost covering all your vulnerable groups, your healthcare workers, your middle-aged groups, and also a sizable population of the younger age groups that we were very concerned about when the cases started to go up about 2 weeks ago. But now we're seeing that as more and more people are getting vaccinated, especially in the age group of 18 to 29, we're seeing the hospitalizations, the ICU admissions, and the daily case numbers come down significantly. I mean, I'll give you an example. I believe in numbers. In the second wave, we had a case rate of 33 people per 100,000 population getting COVID, and a death rate of 35.9 in 100,000 population. Now, in the third wave, we have a case rate which is very similar to the second wave, about 33 cases per 100,000, but our death rate has gone down to 2.1 per 100,000. So I think that is a significant decrease, and that is one of the proofs that vaccination, you were discussing right before this, vaccination is the only way forward. And there's no other way.
Right, that really proves how it protects the public. And now also there are some reports coming that they may even be considering a booster vaccine dose, a third dose for the more vulnerable.
Yes, that's right. And I think it will be the first country in the world to start booster vaccination program. We're going to be rolling the program out in September. Hopefully all the way until January or February next year, covering the vulnerable people, the healthcare workers, the younger population will be a little bit later, but we're going to try and cover the elderly and the healthcare workers and the vulnerable people that have comorbidities like diabetes and hypertension and other things like that. So the booster program will aim to protect us from variants, and it will aim to protect us from the waning immunity that happens that we have seen with the Pfizer and the AstraZeneca jabs.
Right. In fact, Israel has also started it for the elderly, third dose of Pfizer. Could you tell us what the experience has been in schools? You have started vaccinations for those over 12 years of age, but here in India, as we're looking to opening schools, even though our vaccine coverage isn't that good, but if you could tell us what the experience there has been.
Yeah, I think schools have always been a major concern for the parents and for the children. Till now, what we were doing was we were doing daily testing, almost daily testing of the staff in schools. Social distancing in schools was being maintained. However, after the restrictions were lifted, the aim was to vaccinate as many children as possible. And of course, there's going to be hesitancy coming forward, but I'm hoping that those numbers will go up in days to come. Still very low numbers coming in from children being vaccinated, but I think those numbers will go up as time comes. And so far, schools are on holiday at the moment, so we have about 1 month of break to figure this out and try to roll out a proper vaccination program for children.
All right, so that's very interesting. And yes, the vaccination for the younger people has started there in the UK. In India, we're still waiting for vaccines for teenagers. Coming back to that third, booster jab, what would you say about, how there's been a certain amount of criticism about this? With Israel also going in for a third jab, the US was considering it at some point, or Pfizer was talking about it. But the fact that so many across the world still haven't got the first jab, and as countries in the West are going in for the third.
Yes, and unfortunately, that is a big concern, because you can vaccinate your entire population and you can give people booster jabs, but you will not be fully protected from this virus until a sizable population of the world is vaccinated. And due to international travel and mixing of populations, that will always be a concern. And I think the vaccine inequality is evident. COVAX, the program that was started by the United Nations, will have to speed up, and I think richer nations will have to start donating more vaccines to this program so that the poorer nations can get more vaccines available to their populations. Otherwise, there will always be travel restrictions. There will always be red lists, green lists going forward for a few years to come until a sizable population of the world is not vaccinated. And of course, we have the concern of variants. That is always a possibility in countries that are not been vaccinated. Variants will emerge, new variants will emerge. And my concern is that a variant that is faster spreading in the younger population will emerge, which will always be damaging to any country.
All right. Thank you so much, Dr. Veer Pushpak Gupta, for joining us on the program.
Thank you very much for having me.
Thank you.